Well, it's time for our health report, and joining us now is Africa 54 health correspondent Lino Mudu with the latest facts and figures on cancer. Hello, Lino.
Hello, Vincent. Hello, everyone. Well, get this. An estimated 9.6 million worldwide died of cancer last year. That's according to the World Health Organization. The WHO says cancer is the second leading cause of death around the world, with approximately 70% of cancer deaths occurring in low and middle income countries. In our Ask the Expert segment, we spoke with Dr. Kingsley Ndoh, Assistant Professor of Global Health at the University of Washington, and asked him, what causes cancer?
It can be broadly categorized into like four things. One is infectious diseases, which infectious disease-related cancers are one of the most prevalent cancers in sub-Saharan Africa. There are some viruses that can act as a carcinogen, to cause cancer. So things like HPV, which is cervical cancer, is very prevalent in sub-Saharan Africa. HIV too, because HIV causes immunosuppression, and at the same time, it can also act as a carcinogen. And so when you have like an immune suppression, then the likelihood of the person having cancer increases. So that's why people that have HIV that is not well controlled have a higher likelihood of having certain cancers. Then the other thing that could cause cancer is and environmental factors are a constellation of things too, like, it could be lack of exercise, it could just be smoking, it could be your diet, food that is high in fat or other chemicals. It just could be other environmental factors that could lead to a mutation and eventually lead to a cancer. So that's just a broad category, but in that category there are just a lot of other things. Then the third is genetics. Some of us are born with certain genetic mutations that would give a higher likelihood of having certain types of cancers. The very popular ones are what we call the P53 mutation, the BRCA1 and BRCA2 that is very popular for breast. Genetics play a huge role, and that one we don't have any control over. We do have control over infections. If we can develop vaccines, the infection I didn't mention that is so popular is hepatitis B that causes liver cancer. So there's a vaccine for hepatitis B. There are vaccines for HPV. If you can develop vaccines, if you can avoid some of these infections or prevent some of these infections, you can cut down theoretically 25% of cancer cases around the world. And then the fourth category is just unknown. That's why there's still a lot of research going on to find out what causes cancers.
That was Dr. Kingsley Ndoh, Assistant Professor of Global Health at the University of Washington, sharing some causes of cancer. Now, Betty Anyanwu Akeredolu is the First Lady of Ondo State, Nigeria, and she's chairperson of the Ondo State Cancer Control Committee. She's also a breast cancer survivor. Anyanwu Akeredolu says her role as First Lady and personal experience with cancer is a contributing factor in helping her raise awareness against the disease in her country.
So, when my husband became the governor, and of course, it became, how would I put it? It's no longer a secret that the wife is a survivor. Of course, people were curious, and they wanted to know what role I was going to play. And of course, I was very, very eager. I hit the road running, because if I can't say it, if I can't fight for those who don't have voice, I wonder who would. So immediately I began to put the awareness program together, so that at least when I tell people that breast cancer, for instance, because that's the disease the cancer that I experienced or had experience of, when I tell them that it's not a death sentence and they see me, you don't require any rocket science to know that you can beat the disease. With that conviction, I knew that I had to put myself out there and let the world know that after all, breast cancer is not a death sentence. There has been a remarkable improvement in the level of awareness, but a lot has to be done, because one thing is to raise the awareness. Another is for people to purge themselves of the misconceptions. If you only knew that breast cancer was caused by witches and wizards or by spiritual attack, you will still go to the church to seek help. You won't go to the hospital. So what it means is that you have to be persistent in the awareness creation, yes. And I believe that even the uptake of new knowledge or information is in stages.
Anyanwu Akeredolu has been a breast cancer survivor for 21 years. She says in addition to raising awareness, her other priorities include advocating for adequate policies and funding for proper infrastructures to prevent and treat cancer in Ondo State. Regular screenings and advanced treatments are helping more women survive breast cancer. But even when the disease is caught early, more than 200,000 U.S. women each year are faced with possible mastectomy or weeks of radiation. But a new study suggests that for some women, there is an easier third option. Here is VOA's Kevin Enox with the details.
After having a lumpectomy to remove stage 1 breast cancer, Wendy Liebarger expected the radiation treatments to keep her from her work as a pastor.
To have to travel 2 hours, 2+ hours out of my day each day for multiple weeks for radiation treatment, I wasn't sure how I was going to manage that.
But oncologist Julia White offered her another option. Rather than radiating the entire breast, she could get focused radiation to the small area where her tumor was removed, a treatment plan that took just 5 days.
When you look at women who do get a recurrence in their breast after lumpectomy, it almost always, 80 to 90% of the time, comes back to the same spot in the breast.
Dr. White led a study at the Ohio State University James Cancer Hospital that compared cancer recurrence among women who received full and partial breast radiation. It found that women with early-stage breast cancer who had full breast chemo had a recurrence rate of less than 5% after 10 years. They reported about the same results among women who had partial breast chemo.
Short 5-day treatment is just as good as the whole breast irradiation for 4 to 6 weeks.
While partial breast radiation isn't an option for every patient, it gives more women a less intense yet equally effective option when deciding if a lumpectomy is right for them.
It really facilitates more women having access to good radiation so that if they want to preserve their breast, they're able to.
Indeed, there is newness of life.
It allowed Wendy Liebarger to continue to do what she loves without skipping a beat.
I lived life fully through the treatments, before the treatments, after the treatments.
Researchers hope the study will encourage more hospitals to offer partial breast radiation. Kevin Enox, VOA News.
That's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Vincent?
Well, Lenore, thank you very much, and want to ask you to be sure to watch Lenore Moudou's health updates every Tuesday on Africa 54. But Lenore, come to, when you think about the increase of cancer cases, how significant is it for people like the First Lady of Ondo to come out and talk about it, talk about our own experience in this, with this dreaded disease?
It's very significant. As she mentioned in the interview, all eyes were on her because everybody knew that the governor's wife was a breast cancer survivor. So when people saw that she was coming forward to talk about her disease, to talk about her condition, and that she survived it, I think that was the most important message for her, that listen, I had breast cancer, but I survived it. I am the First Lady, and I tell you, this is not a reason to hide your condition. And she talked about, when we talk about this during the interview, she said some women will hide, or some women will think that when it doesn't hurt, it's not something to worry about. So she really urges women to come forward. And we saw in the case of Governor Nyong'o as well, who came forward.
Well, Lenore, thank you very much once again. And that